For the debate, I recognize the member from London West.
Thank you very much, Speaker. It is an honour to rise in this place and speak on behalf of the people I represent in London West to offer some observations, some thoughts, some comments on the government's budgetary policy. This motion calls on MPPs to approve the budgetary policy of the government, and I can tell you, from the perspective of Londoners, this is a budget that has failed to address the real issues that people in my community are facing. And you know, one of the ironic aspects of this government's budget is that, you know, this government is all about fiscal responsibility, cutting red tape, and yet this budget projects a deficit that is a historic amount. We have seen the government, increase spending, increase borrowing, but as others have commented, never before has an Ontario budget spent so much and delivered so little. It completely ignores the real problems that people are facing and the solutions that people were looking for in this government's budget document. So, what are some of the solutions that people in London would have expected? Well, they would have expected a real investment in Ontario's publicly funded and publicly delivered healthcare system. This budget includes some funding to expand interprofessional primary care teams, which is welcome, but it doesn't go nearly far enough to address the reality of more than 2.3 million Ontarians without a family doctor. And in London, the number of Londoners without a family doctor has actually increased to 84,000 people in the London area. So the measures that the government has introduced will make some baby steps toward dealing with the issue, but they won't actually fix it. The budget doesn't include any kind of prohibition around the expansion of private health care, and that is something that I hear about regularly from the people I represent. People are very concerned about privatized for-profit health care. They understand that what that means is that shareholder profit becomes the guiding motive behind the delivery of healthcare services rather than actual patient care. People in my community would have liked to see an investment in the healthcare workforce. They understand that it is nurses, it is the healthcare workers who are provide the backbone of the system. You can't deliver healthcare without healthcare workers. And this government's failure to effectively attract, retain, and return healthcare workers has meant that the government has had to spend $1 billion on agency nurses because they don't have the healthcare workforce in place in our hospitals and our other healthcare facilities. People in London would have liked to see the government get back into the business of building homes. We are in a housing crisis of historic proportions, and it is time for the government to recognize its responsibility to ensure that people in Ontario have access to homes they can afford, to supportive housing, to other non-market housing options, and the government could have moved forward with an initiative that was proposed by my colleague, the member for London North Centre, to create a new agency called Homes Ontario that would do exactly that. It would get the government into the business of delivering on those non-market housing units that are so desperately needed. The budget does nothing to address staffing shortages in our schools and deal with the deficits that school boards are facing. In the Thames Valley District School Board in London, they are looking at a record high $18.5 million deficit as they finalize their budget for this year. And that deficit is largely caused by this government's failure to address the funding pressures that school boards are facing, and it does not. The deficit is also reflective of the government's refusal to help school boards deal with their obligations to provide CPP, EI, and other mandated programs that have to be provided to staff. As critic for colleges and universities, Speaker, I was very concerned to see that this budget did nothing other than re-announce a funding program for the post-secondary sector that had already been announced in February, and that had been not a single post-secondary stakeholder said that the government's funding package that was announced in February, that's repeated in this budget, went nearly far enough to address the crisis that our post-secondary institutions are experiencing. This government's funding, as I said, announced in February, re-announced in this budget, was less than half of what their own expert panel, the Blue Ribbon panel, had recommended in November. And that panel came together to look at what was needed to keep the post-secondary sector stable and sustainable. They had identified $2.5 billion investment over 3 years, and this government's response was a $1.3 billion package, which was a limited 3-year package of grants broken up, which will do very, very little to address the real crisis that colleges and universities are experiencing, and ignores the reality that our colleges and universities are going to lose significant additional revenue dollars because of the 50% reduction in international student permits. And we know from the government's budget document that they are anticipating a revenue loss of over $3 billion for colleges over the next couple of years. College budgets are included in the government's books, so we know what that revenue loss looks like, but there is certainly the possibility that universities are going to experience similar revenue losses. And we already have almost half of the universities in our province are already reporting deficits. So the government's lack of support for post-secondary institutions is just going to make those funding pressures much worse. I want to talk for a moment about another failure of this government, and it was something that we talked about today in question period with my colleague, the member for Toronto Centre, and the two women that she brought to Queen's Park today to share their stories, Kate Alexander and Emily Agar, who were victims of rape and sexual assault, who had reported their sexual assault to the police. Evidence was collected, charges were laid, court proceedings were initiated, and their cases were dropped because of the significant backlogs in our courts, which meant that they were unable to pursue their case within the time that is required, and so their cases were dropped. These are brave survivors who had the courage to share their story, to pursue justice from their perpetrators, and were failed by a court system that is riddled with delays. And yet this government's budget includes no mention of bail, no mention of tribunals, no funding to try to address no additional funding to address the backlogs in our court system and reduce those backlogs. I want to now go into a little bit more detail on what the government has done on primary care and some of the feedback that I am getting from, or I'm hearing from people in London West. Now, I had just mentioned the post-secondary sector, and I will acknowledge that one of the new announcements on post-secondary that was included in the budget was the establishment of a medical school at York University that will be focused on family physicians, which is welcome. However, there is absolutely no timeline for when that medical school will be established. There is no funding attached to establishing that medical school, and most significantly, there is no increase to the operating grants that colleges and universities like York University need to ensure sustainability and stability. So on the issue of primary care, my community in London, I hear all the time from people who are looking for a family doctor. And I want to give a shout out to my constituent, Dr. Andrew Park, who is the president of the Ontario Medical Association, who was my guest on a town hall that I held on March 19th, telephone town hall that was attended by about 900 people. The people who called into the town hall, about 1/4 of them said they did not have a family doctor, but 87% said someone close to them did not have a family doctor. And at the time of that town hall, March 19th, the data that I had available to me indicated that there were 65,000 Londoners without a family doctor. Well, since that time, the Ontario College of Family Physicians released new data saying that there are 84,000 residents actually in the London area without a family doctor. And I want to just share some of the concerns that constituents have raised with me when they don't have access to a family doctor. Danielle Horst says that she has 2 sons, both of whom have been diagnosed with a genetic disorder and ADHD, and she cannot find a family physician to help care for them. She says, I don't want to go to a walk-in clinic and get a different doctor every time who doesn't know my boy's health history. Another constituent has a rare autoimmune disease, and she says, I truly cannot be without a family doctor as my condition needs to be monitored consistently. I have prescriptions that are needed for this condition, and I can't be left high and dry with no doctor to fill the prescription. Another constituent, Lorianne Horley, she said she lost her family doctor, but she was able to get a nurse practitioner, which is great. However, after only a few months of operating her practice, the nurse practitioner said she was forced to close because she could not afford it. The amount she could bill was not enough to cover her rent and her staffing, her administrative costs, as well as pay herself. And we know the Ontario Medical Association, the Canadian Medical Association has pointed out the incredible burden that administrative tasks place on family physicians who don't have the support of an interprofessional health team. And unfortunately, this budget doesn't include any measures to reduce the administrative burden on family physicians that would help help them shift from paperwork to patient care. So that was certainly a missed opportunity. I also heard from a constituent, Christina, who said she does not have a doctor, which means she cannot get her ODSP application filled out. She says, "I am so scared I am going to lose my home before I am able to get adequate help. I am not receiving enough from Ontario Works to pay my bills, and each month I struggle to keep my head above water." So these are the heartbreaking stories that I hear from people in London West who can't get access to a family doctor. And Christina talks about not being able to or worried that she's not going to be able to keep her head above water, and that is certainly an issue that so many people in London are worried about: the rising cost of living, the cost of housing, and what that will mean for their ability to maintain a healthy life for themselves and their families. And we are seeing in London real pressures with housing, and this budget was an opportunity for the government to make a real difference for people in my community and across the province by introducing changes like bringing back real rent control. In London, we just saw a report from CMHC that says that the vacancy rate in London is just 1.7%, and the researchers commented that the annual income required to meet the basic 30% of income affordability threshold is about $73,000 for a two-bedroom unit. But they estimate that only about 20% of renter households in London would meet that threshold. We've also seen mortgage default rates up more than 80% in London, which is the second highest default rate in Canada, as people struggle with cost of living pressures. Talking about rent increases and the missed opportunity, the failure of this government to protect tenants. They've removed rent control off of units that were built after 2018, and I heard from tenants in London West who were hit with a 23% rent increase. They lived at 25 Centre Street. There was an identical building right next door at 45 Centre Street that was constructed before 2018 and did have rent control, and yet the tenants at the building right next door had to face this 23% rent hike, which was totally legal, totally allowable because of the policy decisions of this government. I heard from a senior from the Fox Hollow Retirement Complex, Lorna Mills, who was faced with a 5% rent increase. Now, 5% rent increase, maybe the landlord thinks that would be manageable, but she points out that the average age of the seniors living in her retirement complex is about 85 or 86 years. They get a pension, but their pension is not increasing 5% per year. They are on fixed incomes, and that is unaffordable. We also know how the cost of living crisis is affecting the lowest income people in our community and across the province. The government could have listened to the calls of advocates and agencies who work with people on social assistance and brought in that the doubling of social assistance that is needed to enable for people to live with dignity and afford just basic essentials. And yet the government is just doubling down on its decision to effectively legislate people on Ontario Works and ODSP and keep them in poverty. So, Speaker, as I said at the beginning, this is not a budgetary policy that the people in London West support. It is not a budgetary policy that addresses the needs of the people in London. It is a budget that is a package of re-announcements, half measures, and that doubles down on failed initiatives that have demonstrated that they don't work, and they actually increase the pressures and the challenges that people in this province are experiencing. Thank you very much, Speaker.
Questions? I recognize the member from Lanark, Frontenac, Kingston.
Speaker, I've been having a problem right since I started this job, I think, with misinformation. And, recently on the small radio station in Perth, Ontario, the Leader of the Opposition's on there telling that small community that all our doctors are leaving. I can tell you it's news to our doctors. Earlier today, the member for Waterloo said there's no efforts to rebuild the workforce in this budget. And yet, there's $2 billion for home and community care to stabilize the workforce, $743 million over the 3 years. A new medical school. I'm wondering if the member from Waterloo can tell us what does nothing mean in her speech.
Response, the member from.
Well, thank you for the question. I think I know what the member for Waterloo meant when she made her speech this morning. So I'm happy to respond to that question. Investments in home and community care are not going to stabilize the workforce if it doesn't include the wage increase that those home and community care workers need to be on par with their counterparts who work in the institutional sector. Home and community care workers have been among the lowest paid healthcare workers for decades, ever since the Liberals started to privatize the home care sector. And we hear all the time from agencies like VON and others about the urgent need to increase those wages, to stop those workers from moving to higher paid jobs in other sectors.
Further question, the member from Waterloo.
Well, thank you very much, and thanks to the member from London West, particularly on doctors. And the Ontario Medical Association, at pre-budget consultation, confirmed with us that they spend 19.1 hours every week doing paperwork. They have said that if the government provided some administrative support, then they could spend more time with patients, which would actually provide better health care. And this actually would help retain the health care workers. That is not misinformation. And the fact that the government classifies that in that manner is really disturbing. This morning I also talked about the OMA's recommendation around getting foreign-trained doctors' credentials here in Ontario. I also mentioned the fact that my concierge at my condo, Mohammed, from Pakistan, is a renal specialist. You know what Ontario needs? Ontario needs doctors who are trained and who want to be part of the solution here in Ontario. Can the member from London West comment on the solutions that are right in front of the face of this government, and yet you choose not to do them?
Response, the member from London West.
Thank you to my colleague, the member for Waterloo, for her question. Certainly, we gave the government a solution that could be implemented immediately that would have an immediate impact on access to primary care in this province, and that is to provide administrative support to family doctors so that they could shift the burden of paperwork they're doing currently 20 hours a week, spending on administrative tasks. If that could be taken on by an administrative staff person that would free up those family doctors to actually provide the care that their patients need. We need to be working on all levels, on all fronts, and this government, the investment in interprofessional primary care teams is welcome, but we need the health human resources to ensure that those teams are fully staffed, and that is a longer-term solution. We need to be moving ahead with things that will make a difference right now. Thank you.
Further questions? Further questions? I recognize the member from London North.
Thank you, Speaker. I'd like to thank my colleague from London West for her excellent speech, not only bringing forward the voices of constituents within London, but also providing those solutions that are centred around homes, healthcare, and hope. My question, though, we've seen this government engage in such panels as the Housing Affordability Task Force, as well as the Blue Ribbon Panel. My question to the member, is it a fiscally prudent exercise to strike these panels only to ignore them? And is it socially responsible to strike these panels only to ignore or reject their advice?
The member from London West.
Thank you very much, Speaker. I have to say that there were some concerns when the Blue Ribbon Panel was struck about what kind of recommendations it was going to bring forward, because it included no representation from faculty, no representation from students. So the fact that the government's hand-picked panel did the work and came up with a recommendation that $2.5 billion was needed in our post-secondary sector in base funding over the next 3 years is a real reflection that this was the work of independent experts who made that recommendation. And it is concerning that the government strikes these panels. The Housing Affordability Task Force, we've heard about the government's complete rejection of fourplexes, which is something that the Housing Affordability Task Force had very clearly recommended. So if the government is going to handpick these experts to sit on these panels to review the problems and come up with recommendations, then it has an obligation to move forward with the recommendations that are made.
Further questions? I recognize the member from Hastings, Lennox, Addington.
Thank you very much, Speaker. Speaker, this government has continued to remain absolutely steadfast in our goal to build at least 1.5 million homes, right? Because we need to address the ongoing housing crisis, which is why this government is investing $1 billion through new municipal housing infrastructure program to support those major infrastructure projects, such as roads, bridges, to enable housing in all of Ontario's communities. So, Speaker, through you to the member, can the member please say whether she will be joining us in putting more tools in the hands of the municipalities, of our municipal partners, to help them get shovels in the ground faster on critical infrastructure needs for homes, or will they continue to vote against putting a roof over people's heads?
Question? The member from London West.
Thank you very much, Speaker. I can tell you that the official opposition is going to continue to push this government to do what is necessary to actually meet their target of 1.5 million homes. The budget showed that the numbers are still far, far below what would be necessary to meet that target by 2031. And we're watching this government let $357 million in federal funding that's supposed to go to affordable housing just slip through their fingers because of the spat between the Minister of Housing and the federal Minister of Housing. The federal government has determined that Ontario has only met 28% of its affordable housing goal, and if it doesn't have a plan to address that, then those federal dollars are going to be lost. That is a shame, and we're going to keep pushing the government to come up with a plan that is going to actually meet the target.
Quick question, quick response. The member from Thunder Bay, Superior North.
Thank you, and thank you so much to the member from London for what you've had to say about the university situation. I note that the Ontario Colleges and Universities Faculty Association was here this just a few days ago, and that the Minister of Colleges and Universities chose not to meet with them. So I'm wondering where they're getting their advice from, and if you could speak to that.
Very quick response.
Thank you very much, Speaker. Well, one of the reasons that the college sector in particular, is in such crisis is because the government was getting advice from private colleges who were saying, let us partner with public colleges, let us bring in, unprecedented numbers of international students, and then we can run the colleges on the basis of those international student revenues instead of the public funding that the government should have been providing. So the federal government burst that bubble and forced the government to have to look seriously at how to ensure the sustainability of the sector, and they failed to do that.
Thank you.